And my guest this evening is Dr. Charles B. Simone, and we're talking about how to reduce America's runaway health care costs. And Dr. Simone just got through giving us a wonderful dissertation about the Simone Health Advantage. But while we were on breaks, Dr. Simone, we had a question that came up. And there seems to be a preconceived notion that eating healthy is more expensive. Is that true?
No, it's not the case. In fact, less expensive overall. So you can have a much more economical diet if you have a healthier diet. And we'll explain that in the second half hour in another show.
That's true, because we're going to continue on and we're going to talk about some healthy eating tips for the holiday. But back to prevention. I know that this program that you developed, the Simone Health Advantage, to help stop the runaway health care costs. We talked about prevention being, I think it's probably paramount and probably a very key component.
It's the major
of the
component.
Major component.
It's the only way we can reduce our runaway health care
So
costs.
we talked a little bit about the KidStart prevention program. Why don't we start there in this half? And
our overall program will have a prevention program, not only for the children, but also for adults. But let's talk about the children's program first. We developed in 1980. We started using the information in 1980 in inner city churches. And the KidStart prevention program is unique. There's nothing like it in the country. What we do is teach children of all ages, but primarily 3, 4, 5 up to age 10, 15, those ages there that are very impressionable about what to do, what not to do. We talk to them about the 10-point plan, their version of our 10-point plan, 10-point prevention plan. And since nutrition is so important, 60% of women's cancers, 40% of men's cancers, 80% of cardiovascular disease and obesity, since it's so important, we hit hard on food. We tell them, and you've heard it before, we tell them to avoid four-legged animals.
Oh, yes.
We tell them to avoid shellfish and dairy products unless it's skim or non-fat products. Because those three major products have all the fat, all the high cholesterol, all the things that will link to these higher risk diseases. So we need to get rid of those foods or minimize. So what do we have left? We have two-legged animals, chicken, turkey, preferably, and here's where the expense may be for chicken and turkey, the organic or free-range turkey or chicken are a little more expensive because they're not feeding them estrogens and antibiotics. You can taste that.
So it's a little different taste involved,
too. A little different taste
too.
And much more healthy. So you want to avoid that if you can. If you can't, then the two-legged animal is just fine. Just keep eating those. And swimming fish, especially from the ocean, as opposed to the farm-raised.
As an example?
Well, in this country, we raise 4 fishes at the farm. Catfish, trout, tilapia, and salmon. You can buy them also from the ocean and the rivers and streams. So you want to make sure that you're eating it because generally, not always, but generally, they feed those fishes, the farm-raised fishes, the same foods that they feed the cattle, the 4 legs. So you want to avoid that. In addition, we encourage the use of vitamins and minerals. Vitamins and minerals at low doses are very inexpensive. And we know today, USDA published an article, a paper in 2005, and said that the food supply in our country has anywhere from 14% to 400% less vitamins and minerals in it than they did in 1975. So it's important that we supplement our food supply with vitamins and minerals. We'll talk about antioxidants later. So our children need to be on a good diet, low fat, high fiber. In fact, when we did this study early on in the early 80s, Senator Bradley was a senator at the time, we had to get special permission from the U.S. Senate by way of Bradley to have a low-fat diet for 6 lunches. We had to get special permission to do that.
Just for 6?
Yeah, because we have a very high-fat diet in the lunches in our school system, and that has to stop. We can't prevent disease if we're feeding our most young and most old people disease-provoking foods. So we need to watch that. We then talk about the misuse and non-use of tobacco and tobacco products. It's a horrible thing, and we've known it for years.
Yes.
But we have to simply impose more more on our public. Alcohol, 2 or 3 drinks a week, 2 or 3 a week, only a week, will give a woman a risk of breast cancer 250% higher. A man, prostate cancer risk 180% higher. So seemingly a small amount of alcohol is a major carcinogen. So we teach our young children early in life not to drink anything over 2 or 3 a week. Not a day, I said, but a week. So it's a small amount.
Now, what about physical activity? Because we're talking about the kids.
Yeah.
And,
very few states, except New Jersey, has a physical activity program in their curriculum in school.
Exactly.
We need to invoke that back. We need to have a physical activity program that is mandatory, that children have to spend whatever it is, an hour or 2, several times a week, because we need to decrease our obesity. 65% of Americans are overweight. No, obese. Obese, not overweight, obese. And that's our children. Many of our children now are on cholesterol-lowering drugs and crazy drugs like that to lower their cholesterol when they're age 15, 14, things like that.
And haven't they also seen an increase in type 2 diabetes in this country?
Absolutely. Not only in adults, but also in children who are overweight, of course. So we need to do things to slim them down, eat the right foods, take the right nutrients, don't smoke, don't drink, and physical activity is a must. A must.
Okay.
Part of that, and that's part of our 10-point plan as well. We also need to teach them how to relax mentally, because stress will suppress the immune system, and that harms them overall. And we have a stressful society today that we didn't have even 20 years ago.
Yes.
So we need to teach them, and we have effective methods of doing it. Music is a great way. Prayer is another great way of doing it. Even hot showers, hot water is a great way of reducing stress. So these are important things to teach our children that have few consequences and don't cost money.
And it's like training our children in the way in which they should grow up.
Forever.
And it becomes a part of their lifestyle.
Forever.
Correct?
Yes.
Now, is there anything that you'd like to say? I know we talked about the KidStart program, and we touched on the 10-point program and prevention.
The same factors apply to the adults that we're talking about with this Simone Health Advantage. We need to teach them how to modify their lifestyle factors to conform to a healthier plan. Now, it's hard to lose weight. You and I both know that. But, you know, we gave a tea not long ago, and we asked all the people in the audience, 300 people, to pledge 1 pound a month to lose weight. And they all raised their hands.
And when you put it that way, 1 pound a month didn't sound like it.
So now think about 2 years from now, that's 24 pounds. Think about that. That's a lot of poundage in a short period of time. And when you lose weight, your sugar levels come down, your cholesterol levels come down, your triglyceride levels come down, you feel healthier, you have better self-esteem, you're going to be more productive. So it is hard to lose weight, 20 pounds at a time, but it's easy to lose 1 pound a month. So that's what we're going to look for. We're not looking for huge differences. We want small increments that are doable. We want milestones that people can do, and that's what this prevention program will be for adults, a doable program.
Now, I have a question because actually this was something that I just thought about because I know we've often talked about meditation. I personally use the shower method and music. But what about rest and getting proper rest? Sometimes, you know, especially in the summertime hours, you see the kids, and I'm like, gosh, you know, shouldn't they be in the bed? Don't they need rest?
You're right about that. We all need proper enough sleep because children grow during their sleep, and we adults repair ourselves during sleep. So it's imperative to have proper rest. And more than that, the so-called REM sleep.
Yes.
So when you go into REM sleep, then you're really resting the body and the brain.
And that also helps as far as
growth,
repair,
the immune system, everything.
I was going to say, I wondered if that had something to do with the immune system.
So the prevention program, which is urgent for our nation, can easily be adapted for everybody, and we can give them incentives to do it. And that's the key thing. I think we will help every American, and we will help this great nation of the United States.
And this is a great country. We're embarking upon some new things in the upcoming new year.
That's right.
And, you know, we're excited about the new administration that's coming in. And we're especially excited because I always tell people you're preaching to the choir, because as long as we've known Dr. Simone, we've heard about prevention. But it's like, who really practices it, you know? It's kind of a term that's thrown out there or looks good in print.
But now we could probably give them an incentive, a financial incentive to become healthy and to help their families become healthy as well.
Okay, so now, in closing, is there anything, if we could kind of sum it up, how to reduce America's runaway healthcare costs? I'm just so impressed. I found out on the way here with you that you're going to be presenting this.
Yes.
Is this correct?
Yes.
In Washington? Do you know how soon?
Pretty soon, I think.
Very nice. And especially since President-elect Obama has called for an open forum. He's looking for all the help he can.
That's right.
And Lord knows I thought about throwing your name in the ring, okay? But I was very pleased to hear you say that you were doing this. So we've been doing this here in Trenton, in Mercer, in New Jersey.
So now we take it to the next level.
We're taking it to the next level. What about children playing outside? Does that help? Like today was a nice day. Because I remember my grandmother used to always say, go outside, get the sun. You know, I mean, we don't want to overdo it. But as far as being in sunlight and just, and I know exercise, but, you know, kind of getting that sun.
We need to get out more.
Get more.
You know, with all these video games, we're becoming more and more homebound as children. And that's not the good thing to do. We need to get out more.
So we do need that. And I guess that would stand to reason for just about all of us.
All of us, yeah.
I know after the tea, I dropped my weight, by the way.
There you are.
And but that's another show. We'll talk about that because we did all raise our hand and make that promise. How to reduce America's runaway healthcare costs. Dr. Charles B. Simone is my guest this evening. Thank you, Dr. Simone. And we